In Arizona, the coronavirus numbers are staggering. The state has the highest new case rate in the country and the second highest average daily deaths. The Latino community there hit especially hard. But just one day after President Biden took his oath of office, there is hope. NBC News correspondent Antonia Hylton is in Scottsdale, Arizona. Antonia, Arizona went for Trump in 2016. President Biden flipped the state, though, in November. What do people there in Scottsdale want to see from this new administration, particularly in its handling of the coronavirus pandemic?
Hey, Allison, the Latino community here is particularly anxious about seeing the Biden administration make good on its promises and get this pandemic under control. Here in Maricopa County, where I am right now, 40% of current cases are Latinos. And that's because here they are on the front lines in almost every industry, agriculture, in retail shops, grocery stores, getting food on people's tables, and they are catching the virus in the process. They tell me, those Latino voters, that they want to see this vaccination process sped up considerably, and they want information about the vaccine and its safety in English and in Spanish. They also are eager to get a next round of stimulus money. For many Latino families struggling financially here, they feel like that could be make or break for them in the coming days. And frankly, they feel like they are owed this from Biden. Latinos here feel like they are the reason he won the state of Arizona. Maricopa County, as you mentioned, flipped from red to blue. And Latino activists here, they made phone calls, they knocked on doors, and they're the changing face of Arizona and certainly of the county seat here. Take a listen to this conversation that I had with Andrea Cervantes. She is a student at Arizona State University, and both of her parents, who are immigrants, recently caught COVID.
Wow, so they're really optimistic and hopeful for this administration, and I am too, but we just need to remember to hold these people accountable, because it feels like such a relief coming from this past administration to this administration, but I can't hope to feel that maybe something's going to go wrong. So really uniting here with the community and people that I've met and holding these people accountable is what I look forward to.
That cautious optimism that you're hearing from Andrea there is shared by almost everyone that I've spoken to. They say that Latino voters here, business owners, organizers, they are going to be watching the Biden administration very closely over the coming weeks and days, and they're going to be calling them out if they feel like resources don't come here and the pandemic, the circumstances of the pandemic don't change soon, Allison.
So let me ask you this. Maricopa County tweeting about the vaccine rollout. It is recommended to get the second dose of vaccine 21 to 28 days after your first dose. But due to vaccine supply, this might not always be possible. Antonia, I understand the Maricopa Health Department gave you a no comment when you asked what they need for vaccine distribution from the Biden administration, but that the Phoenix mayor's office did speak with you. What did they say?
Yeah, so the office of the mayor of Phoenix was actually eager to speak. And what they told us is what they really want the federal government to hear is that they need money sent directly to the cities. The staff here, even in a city as well-known and big as Phoenix, is strained trying to manage all these processes. And in particular, what they mentioned was they really need support trying to give people rent and mortgage assistance. There are many families here that are unable to make those payments. And those financial challenges are directly related to job losses or hourly wage losses because of the pandemic, Allison.
What else would the Latino community there like to see from the Biden administration? What else have you been hearing in your time there?
Well, you know what I found interesting was almost everyone that I spoke to immediately brought up mask mandates, which, of course, has been at the top of Biden's mind as well. Because they're the frontline workers and they're in these shops, in these grocery stores, they are exhausted seeing people flout mask rules, come into their places of work without masks on, and expose them to the virus. They feel like they're the community that's getting disproportionately exposed and disrespected when people choose to not follow these rules. And then after that, after talking about the mask mandate, the vaccination process, they always bring up immigration policy, which, of course, the Biden administration has promised to take quick action on, but they're eager to see additional protections for migrant workers, new asylum policies here, as asylum has become almost impossible here in this country over the last several years. And then they also want to see a pathway for citizenship. Here in Arizona, many Latino families, they are of mixed status. And that means that some of these families have not been able to access federal aid, unemployment benefits, and they have children who are often citizens who, when their parents lose work, are not getting food on the table, not getting support. And they hope the Biden administration takes action to make sure that all of these families, all of these people are protected.
Yeah, some really important stuff there. They have needs that are simply not being met. We'll see what happens with this next administration. Antonia, I have to tell you, you know that Vaughn Hilliard is often in Arizona, and we say it when he is there as well. You will never get a more beautiful background in a live shot than you get when you are in Arizona. Absolutely breathtaking.
I know. Everyone's jealous of me today, Allison. But, you know, I'm happy to be in this beautiful, crazy state.
Amazing. It's gorgeous. Thank you so much.
Thank you, Allison.
Inauguration Day, the deadliest day of the pandemic so far in the U.S. More than 4,100 Americans died. Today, the Biden administration laying out their plans to fight the pandemic. Here's Dr. Fauci.
One of the things that was very clear as recently as about 15 minutes ago when I was with the president is that one of the things that we're going to do is to be completely transparent, open, and honest. If things go wrong, not point fingers, but to correct them and to make everything we do be based on science and evidence. If we get 70 to 85% of the country vaccinated, let's say by the end of the summer, middle of the summer, I believe by the time we get to the fall, we will be approaching a degree of normality. It's not going to be perfectly normal, but one that I think will take a lot of pressure off the American public.
Let's bring in NBC News medical contributor Dr. Natalie Azar. Dr. Azar, Dr. Fauci saying there that we could have a degree of normalcy by the fall. Besides getting vaccinated, what else do we need to be doing right now to make sure that that can happen?
Well, vaccination is definitely the number one thing. And I think, you know, Dr. Fauci did address some component of vaccine hesitancy at the press conference tonight. And part of the Biden plan is actually also to launch a public education campaign, to really educate folks about the safety and the efficacy of this vaccine, acknowledging certainly that communities of color and other, minority groups, have been treated with inequity historically, by the government and by science. But, until we get to that point where 70 to 80% of us is immune, we are all going to continue mask wearing. The one big question mark that we still don't have the answer to is whether or not vaccination prevents asymptomatic transmission. So we certainly have our work cut out for us. But I truly think that the Biden administration is coming into this with their eyes wide open and attempting to attack or handle this pandemic from multiple different angles.
Dr. Azar, Dr. Fauci also said that the key to stopping the new variants of the coronavirus from getting out of control is getting enough people vaccinated so it can stop replicating. For those of us who are not medical experts, not scientists, can you explain how that works?
Yeah, he said it very easily or nicely, I should say. The virus can't mutate unless it replicates. Meaning that if you have people who are not getting vaccinated, this was sort of his plug for people to get the vaccine. If you're not getting vaccinated, then you are susceptible to infection, and you're also likely to transmit it to other people. The virus can only mutate if it's alive. And if it's alive, it's going to be replicating and going from host to host to host. So if we can stop that chain of transmission with vaccination, the virus will no longer replicate. And if the virus can't replicate, it can't mutate.
So I have to ask the question that I'm sure so many of our viewers are wondering right now. How do we get people vaccinated when we are hearing reports out of Pennsylvania that they can't get enough vaccines, enough shots for their mass vaccination sites, when in New York City appointments are being canceled? If people can't get appointments, if they can't get access to the shots, what do we do?
I think things are going to change in the next couple of weeks. But, as Dr. Biden, as President Biden mentioned, it took us months to get into the situation that we're in, and it's going to take time to get us out of this. It's not going to be an overnight thing. Whether it's a supply issue or a distribution issue or an administration issue or a supply chain issue, there are so many different places along that, that conveyor belt, if you will, where problems have occurred and have sprouted up throughout the country in a very heterogeneous manner, which is why it's so important that the Biden plan is really this sort of cross-governmental, cross-sectoral, meaning a combination of federal resources with private industry or commercial pharmacies. It's really an all-hands-on-deck approach. The simplest answer is for folks who are frustrated that they can't get a vaccine today. You will be able to get a vaccine eventually. I think we were kind of misled a little bit about, how easy and everything it would be for everyone to get a vaccine once they were approved. It really was. I think it was billed a little bit too simplistic, I think, for the actual execution of it.
We haven't talked a lot lately about things like N95 masks and swabs. President Biden, though, was saying that he's going to use the Defense Production Act for those. How big of a difference will that make? How much of an issue is this still?
It's still a big deal. We can't forget about testing or contact tracing or all the things that are necessary to go into opening schools. I mean, we're so focused, as we should be, on the vaccine right now, but there are still, many other layers to this pandemic response. And part of that are, just the raw materials of testing and is certainly administering the vaccine. One thing that the press secretary brought up tonight in the presser was, the DPA utilizing or employing the DPA to facilitate manufacturing of certain kind of syringe that's able to extract one extra dose out of a vial. Something as small and simple as that, but multiplied, many-fold will make a big difference. So again, it's about using every available resource, whether it's something as small as a needle or a syringe to as big as we need to literally manufacture more of the Moderna vaccine. I think everything needs to be on the table.
Yeah, it seems no detail too small when we're trying to get so many people vaccinated. Dr. Azar, thank you so much for being on with us.
Thanks, Allison.
A mass vaccine site in Pennsylvania sitting idle. New York City, as we've said, canceling more than 20,000 scheduled appointments. States all over this country are struggling with their vaccine rollouts. But over in West Virginia, they are having a lot of success. NBC News Now correspondent Maura Barrett shows us what they're doing differently.
Without a federal system in place for vaccine administration, each state is doing it a little differently. But some states, like West Virginia, are having better results than others.
We don't have vaccines in a warehouse sitting on a shelf. We've got them in people's arms.
West Virginia is topping the charts with one of the best per capita vaccine rates in the country. It's also near the top of the list of states administering a high rate of doses distributed to them. But how exactly are they doing it? For one, they're focusing on high-risk populations first. The state was the first in the country to complete first-round vaccinations in nursing homes and long-term care facilities. But there was another strategy they used.
Our great National Guard and all of our health officials and everything came up with an idea to basically recruit all the local pharmacies.
Our state is very unusual in that Walgreens and CVS are not nearly as well distributed across all of our state. Half of our pharmacies in West Virginia are independently owned. And we organized over 200 pharmacies in a network that could reach people not only in the population centers that we have, but in the rural communities as well.
That was something that we were not going to be able to have if we had activated the federal pharmacy partnership early on, because we knew that there was at least a 2-week delay with the federal pharmacy partnership.
This worked well initially, but officials soon realized they needed to change course.
We had to make a really big pivot and everything, a pivot away from really going with the Walgreens and the CVS to going with our National Guard.
At least 16 states have activated the National Guard to assist with vaccinations. President Biden plans to deploy both FEMA and the National Guard nationwide to help increase vaccination numbers across the board.
By the end of our first month in office, we will have 100 federally supported centers across the nation that will ultimately vaccinate millions of people.
When it comes to the number of doses distributed, West Virginia has received roughly 200,000 doses. This is significantly less than larger, more populous states like Texas and California, who have received 2 and 3 million doses each, respectively. Fewer doses to divvy out means less of an organizational headache, but West Virginia's vaccination rate is impressive nonetheless. Now that the state is wrapping up their first round of vaccinations, they're ready for more.
So now what we need in West Virginia, we need more vaccines.
Biden's post-inauguration plans include invoking the Defense Production Act to rapidly expand vaccine manufacturing, but organization will remain challenging.
Whether it's an American in West Virginia or California or Pennsylvania, if we can get a shot in the arm, we got a real chance of saving somebody's life.
The question has been floated before. If Amazon can get packages delivered in a day or two, imagine what it can do for COVID shot distribution. We may soon find out. The company offering to help President Biden reach his goal of vaccinating 100 million Americans in his first 100 days. NBC News senior media reporter Dylan Byers all over this story. Dylan, first of all, it's been a while. It's great to see you. Amazon Worldwide Consumer CEO Dave Clark offering to help in a letter to President Biden. What did he say and how would this work?
Yeah, effectively what he said is look, we have basically the best logistics and distribution network in the country. And like you said, we're capable of getting people almost anything they want or need in 2 days or less, and in many markets in 2 hours or less. Let us help you. And we are here to help. The Biden administration, generally speaking, inherited the lack of a COVID plan. There is no real distribution plan at the federal level. It has largely been left up to local governments, cities and states. And, the notion that we live in a country where we have services like Amazon that are so effective at getting people what they need, and that we would not leverage that with something as urgent as the vaccine. The argument that Dave Clark at Amazon is making is, look, let us help you do this and let us get this done faster.
So the offer also coming with a request. What does Amazon want here?
Right. So that would be the other part of this, which is also significant, which is that they're also asking that all of their workers get the vaccine as fast as possible. And on the surface, that can seem a little selfish, or that perhaps this offer comes with some caveats. The counter argument, I guess, coming from Amazon is, look, during a pandemic, forget about the vaccine for a second, during a pandemic, Amazon's ability to do what it does has helped people, has helped keep a lot of people out of public situations and kept people social distancing. Their argument is all of these people who are going to their distribution centers, the people who are delivering the packages, all of the people who work there would benefit from having the vaccine as well. So it's a bit of an ask for Amazon employees, but it's also an offer to the country to get this done faster.
So I think we're all wondering here, how's the Biden administration responding? Is this something we actually might see happen?
This is a great question. And unfortunately, the White House has been entirely mum. Now, in their defense, they just got there, and obviously their inboxes are very full. But so far, they have not commented. We've reached out to Jen Psaki, the new press secretary, reached out to other folks on the communications team. There's no word yet from the Biden administration as to whether or not they plan to basically leverage will be a public-private partnership.
Dylan, do we know, did Amazon make the same offer to the Trump administration? And if they didn't, do we know why they might have waited?
Well, so they did not extend the offer in this way. They did not extend an offer in a letter directly to then President Trump. What they did do is they were working with the CDC and the Department of Health and Human Services, but there was no sort of overt, very public offer directly to Trump. And that certainly has riled up some folks, certainly Trump supporters, who have said, why would you wait? If you were Amazon, why would you wait? I'm not sure that's exactly fair. I think that there was always a lot of animosity between Amazon and the Trump administration. I think the vaccines have only started to roll out, and I think Amazon saw this as an opportunity to work with an administration that might actually want to work with it.
All right, so let's see if they can apply their Amazon Prime skills to getting COVID shots in people's arms. Could be a winning combination. We'll have to see. Dylan, thank you.
Thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.